Dr. Ashwani Garg, one of the founding members of the Indian Association of Functional Medicine, is with us. He is a functional medicine practitioner, more into the nutritional supplements and all. So he will be giving some insights about one of the important nutrient, that is magnesium, which is overlooked by the physicians and nutritionists. So I welcome Dr. Ashwani Garg. Doctor, as a physician, we used to, or the general physicians used to, or even the nutritionists used to give more importance to the nutrients, like especially the micronutrients like calcium, sodium, etc. Right? But I believe that magnesium plays an important role, sometimes more than calcium, when it comes to our general health. So what is your take on the importance of magnesium in our general health?
Right. So I think first of all, it's wise to mention, when we test people, lot of people are very, very low, significantly low on magnesium and high on calcium. Okay, the intercellular levels of calcium is high, which is causing a lot of trouble. So please don't take unnecessary calcium supplements. Now coming to magnesium plays multiple roles. Now help you to connect to specific things. Now if somebody has a GERD, that also means that upper sphincter is not relaxing. When the sphincter is not relaxing, muscle of the sphincter is not relaxing, it does not close down. And when lack of magnesium can lead to GERD, as simple as that. Day to day, everybody has this GERD.
So GERD means gastroesophageal reflux disease.
Yes.
GERD. Okay.
Correct. The food from the stomach can float back to the
reflux, doctor.
Yes. Just magnesium deficiency can cause that.
Wow.
Okay. If somebody gets a cramp in their muscles.
Usually we call it as a calcium deficiency.
Yes, it's actually magnesium deficiency.
Wow.
A lot of women have this weaker bones.
Yeah.
It's not calcium deficiency, it can be magnesium deficiency.
Yes.
A lot of people develop this hypertension. That also could be because of the magnesium deficiency. A lot of metabolic function, for example diabetes, for example thyroid health, is poor because of the magnesium deficiency.
Wow.
You don't relax, you're always agitated, you don't sleep well. It could be because of magnesium deficiency. So that way, so many numerous things this magnesium guy is doing for our body. And just because we don't test most of the time, and our soil and food is deficit, we are deficit, as a consequence we have to face the brunt of magnesium deficiency. So I think we should all functional medicine practitioners or healthcare practitioners, please do test your magnesium for your client. You can do it in the serum. You can also do it in the hair sample assessment, where you get the ratios with different minerals. And if it is coming low, please support your client through food. And if that is not enough, maybe a supplement, good quality supplements.
So since you mentioned about supplements, there are different forms of magnesium that's available in the market. Can you please a little bit throw some light on this?
Right. So these are chelated with different compounds. One is, for example, oxide or citrate.
Oxide.
Yes, or citrate. They generally tend to stay in the gut. They don't get absorbed. So if somebody is constipated, then citrate and oxide is a good form to take for constipation. If somebody want to relax, then glycinate, magnesium glycinate or bisglycinate is a good form. You want to deliver more magnesium to the brain, then you want to use a form which is called magnesium threonate, for example. So that way, different forms of magnesium with different chelators with them or binders with them will take it to different parts of the system. And more systemic form is glycinate and threonate and bisglycinate.
So you mentioned about different forms like magnesium oxide, magnesium citrate, magnesium glycinate, magnesium bisglycinate, yes, magnesium threonate. Okay, so among which, in your opinion, which one is the best thing? At least, is there any best one?
Right. So I think that the most of us who are stressed out and calm and sleep better and relax better, then glycinate, bisglycinate, magnesium form is good.
So you're saying that according to your symptoms, you can change the form of magnesium supplementation. Right. Whether if you need more relaxation, then go for glycinate or bisglycinate. Yes. If you're having some gut issues, go for magnesium oxide or magnesium citrate. Am I right?
That's right.
Okay, fine. So what is a recommended daily dosage of magnesium?
Right, again, depending on the severity of the symptoms, etc.
Yeah.
But at least we can elemental form of up to 200 milligram to 400 milligram elemental form we can go.
So you said about elemental form, 200 milligram to 400 milligram
Yes.
per day.
Per day.
Right? Okay,
Yes.
great. So for the common man, is there any side effects if you are taking any magnesium supplements?
We haven't seen any side effects except when you take, let's say, citrate form, oxide form, and you overdose, you might get diarrhea.
Diarrhea.
That's the only thing that can happen. If you very, very overdose, maybe some ionic imbalance.
Yeah.
But generally, most of the forms will not have this thing. We're doing under guidance. We haven't seen any issues so far. So this is something that is required, and luckily body knows how to balance most of these things. Okay. These are not chemicals. These are something body understands very, very fundamentally. So even if overdose, body can eliminate easily.
Yes, okay. So it won't get stored in our body and later it won't be get toxic also.
Very highly unlikely.
Wow, that's great. So let me conclude in this way that this is one of the important mineral that we require, which is often overlooked. Am I right?
That's right.
So you are saying that we need to give more importance to this one supplement, that is magnesium.
Very, very important. Very important.
Let me ask you a question in a different way, that in your clinical practice, so what are those conditions, or for what kind of patients do you usually prescribe the supplement of magnesium?
Right. So now we work with autism.
Yeah.
A lot of hyperactivity is there. There, magnesium plays a good role.
Yeah.
A lot of these autistic children has high copper. To balance copper, we need to give zinc also.
Yeah.
Now, somebody doesn't sleep well, we have to give zinc. Constipation is a chronic problem. We have to use different forms of magnesium to release the constipation. The muscle spasms are very, very common.
Yeah.
They get this muscle twitches. Then magnesium is very important. Because the stomach is bloated, they tend to reflux food. A lot of gut problems that we deal with.
Initially you said about GERD also.
Yes. This is where magnesium also plays a very, very important role.
What about the cardiovascular diseases?
Yes. So like I said, hypertension is a growing area, and to relax these vessels and improve the blood flow in the body, magnesium does play a
Yeah. Any action on the brain?
So cognitively also it does help, because it improves the metabolic function, thereby mitochondrial function improves, thereby brain function improves. So from that standpoint of view, also from a relaxation point of view. So yes, both ways it helps the person.
I learned that magnesium can be used in migraines also. Am I right?
Yes. Migraine mostly inflammation, and then that leads more physical tension in the system. So magnesium can relax and also help to reduce some inflammation.
Wow, that's great. So such an important mineral is magnesium, and we used to often overlook this important mineral, that is magnesium. As doctor said that in his clinical practice, he used to have this supplement of magnesium, especially in terms of GERD or gastroesophageal reflux disease, from muscle spasms, from cardiovascular disease like hypertension, even in autism cases, migraine, etc. So that's the importance of this mineral magnesium. So if you are suffering from any of these kind, definitely you can check with your healthcare practitioner whether you require a magnesium supplement or not.